Hello, my name is Jakia Sampson, and welcome to my senior portfolio. The purpose of this portfolio is to discuss my learning objectives, goals, and outcomes that I have been able to establish and accomplish while at Nazareth College during my academic years. The knowledge and skills that I have gained through Nazareth College has been able to be applied to the work that I do at my internship. I am currently an intern at Catholic Family Restart Program, where I work along with individuals dealing with substance abuse. Alongside that, I also can use the knowledge and skills that I have gained to apply to my personal job, where I'm a caseworker, work with vulnerable women who are currently pregnant, who are at risk for poverty or living in poverty. I help educate, advocate, support, and eliminate any barriers that they are currently facing. So in this portfolio, I will address key factors that shows that I have demonstrated the skills and the knowledge and have the tools that I need to be a successful social worker. I will discuss my professional goal. What is it that I want to do? How will I do it? The population I want to work with, the services that I want to offer to promote a healthy well-being for my clients. I will discuss core values that are vital as a social worker, and I will hold myself accountable to and work by those standards while working with my clients. I would discuss three strengths that I have that is beneficial for the work that I do and the engagement with the clients. I will discuss the most effective social work practice that I believe will allow me to actively engage and meet my clients' needs. Last but not least, I will discuss a theory that I believe is the best approach when dealing with the clients. So, let's start off with my three strengths. As a social worker, we must have strengths, and the three strengths that I believe is valuable as a social worker would be communication, active listening skills, and patience. These three things are very important when working with clients. First and foremost, I must be patient with the clients, allowing the clients to take lead, meeting the clients where they are currently at. I have to understand that I cannot implement what change I want to see the clients doing. How are they going to take the steps for change? I must allow them to lead the process because I am working along with them and not for them. This is a team effort between the client and I. So, first and foremost, I must be patient with them, um, knowing that they are competent in making a decision for themselves. Along with patience, I must be able to support their needs. And in order for me to support the client's needs, I must be able to actively communicate with the clients. Communication is key. Setting a rapport where the clients trust you, allowing them to know that this information that you're disclosing with me will stay here and is confidential between you and I. Keeping an open line of communication with the client is vital. Using language that they understand so that way they can get a clear, precise understanding about the interventions that are going to take place. Just about any areas in life, just having language that they can understand and that they can verbalize to me, and I'm able to verbalize to them a clear understanding of my expectations of them and then the expectations that they have of me while they're working along with me. Based upon communication, active listening skills is very important when working with clients. I must be attentive to the client's needs. I must listen to what steps they are taking. How are they taking these steps? I can reflect on the client and tell them, you know what, this is what I'm hearing. I'm understanding this is going on in your life. By using body language, not interrupting the client, letting them take the lead to disclose information that they want to start with by disclosing with me first. In between, I can ask questions and address concerns. I'm here to provide feedback to the clients to help them eliminate barriers, give them the skills and the tools that is needed for them to use when there are obstacles in their life. I can show empathy when I feel that the client is having a tough time or there's a situation that is bothering the clients, making them feel less than important. I can ensure that the client is important to me by being there to support their needs. So I must always treat the clientele with self-worth and dignity, showing that I care, treating them with a respectful manner, being mindful of the client's cultural, religious beliefs, what they stand for, their morals and values. I have to advocate for clients, so I must treat them with dignity. I respect them as much as respect they give to me. I must give it to them also. I have to allow the clients their self determination, allowing them to make the decisions that they feel meets their needs. It gives them the opportunity to change and address their own needs without me implementing what they should do, how they should do it, and when they should do. With that, I believe the holistic approach is appropriate. I feel like the holistic approach is what we need to understand the individual. The holistic approach looks at all aspects that contribute to the life of the clients. We look at the physical, the mental, the emotional, the social factors, biological factors. All these factors influence the behaviors that our clients exhibit. Over the course of time, clients learn morals and values based upon their interaction with their environment. Um, Internal and external factors impact the mental health and wellness of our clients. In order for me to work on those areas, I must know which factors are vital, which ones must I start with, which ones are key. But the whole approach, not looking at the problem itself, but focusing on the client as a whole, the different components and the aspects that contribute to the behaviors that the client exhibits. I do realize that based upon how one person adapts to their situation determines their behavior. If a person adapts negatively, they look at it as a negative outcome, there's going to be negative behavior. If they learn how to adapt to their situation and a positive outcome, there's going to be a positive behavior. So, with that being said, psychosocial development from birth until death, understanding the different influences, the different life trajectories that have occurred during the time the person was born, um, until whatever point they are in at life. We have to learn how to work through those factors. We got to focus on the solution rather than the problem, because these factors plays a very important role into the client's well-being. So with that being said, my personal goal, my career goal is to work in the criminal justice system. I want to either become a probation officer, a reentry counselor, or a prison counselor. My goal is to help individuals become productive into society, setting them up with the services that they need prior to releasing them out of prison or as they become actively engaged in society. Set them up with the services that is needed for them to have a healthy well-being.